Hello, my name is Naya. I have Mimi, Haley, and Abby here as well to present today. Together in our clinic course, we started learning about the use of laser therapy in dentistry. This sparked our curiosity as a group about the extent of treatment for periodontal conditions. We decided to make our informational research poster topic specifically about laser use for periodontal regeneration. Our poster is Lightsabers of Dentistry, Lasers for Periodontal Regeneration.
The problem presented is the deterioration of the supportive structures of teeth. This deterioration is often recurring and ultimately poses the risk of tooth mobility and the eventual loss of dentition. The objective of laser therapy when treating periodontitis is to restore periodontal attachment of both hard and soft tissue. This is done through the use of various lasers on periodontal pockets surrounding the teeth in the oral cavity. Through our evidence-based research, we have seen the beneficial effects of laser therapy on lost attachment in the periodontium.
Our PICO question is, does laser therapy promote greater periodontal regeneration in comparison to traditional therapies?
The first study in our methods and results section describes a single-blinded randomized study following the application of erbium YAG and neodymium YAG on moderately to severely affected periodontal tissues. Comparisons were made between 4 categories: SRP with no laser intervention, SRP with either ER YAG or ND YAG, and SRP with both ER and ND YAG. The results showed greater increase in clinical attachment in subjects who received a combination of SRP with laser intervention compared to the SRP alone.
Our next study compared 26 patients with generalized aggressive periodontitis. They compared 3 different groups, SRP only group, an SRP with YSGG laser group, and SRP with the diode laser group. And comparing the baseline levels and the post-treatment levels of interleukin-1, interleukin-8, and tissue necrosis factor, the most significant difference was observed in the SRP and YSGG laser group, and the least difference was observed in the SRP only group.
The third study was a double-blinded randomized clinical trial where impacted third molars were extracted and then treated with laser therapy. Results for the study were based on redness plus swelling and pain plus dehiscence paired together for the postoperative state of the incisional wound. In all 4 categories, it was discovered that there were significant differences in wound appearance and pain degree at each visit, but the degree of difference between each paired group was not significant. Overall, this study demonstrated that laser therapy was useful for the reduction of immediate postoperative complications after intraoral surgeries.
The final study looked at a group of 22 consecutive non-blinded patients diagnosed with moderate to severe periodontitis who were treated using laser-assisted new attachment procedure, or LANAP. Following a single session, all 22 individuals completed a reevaluated follow-up after 12 to 18 months. Pocket depth, clinical attachment level, and furcation involvement showed substantial improvement.
The wavelength and power of the laser determines the use for treatment on both soft and hard tissues. LANAP is specified for periodontal regeneration. ER YAG, ND YAG, YSGG, and diode lasers are indicated for disinfecting periodontal pockets. All of the laser types are useful for creating an ideal environment for regeneration and reattachment. A common limitation in all of the current studies is the small sample size. All of the studies show clinical significance, but none were statistically significant. Further studies with larger sample sizes may enhance the correlation evidence between laser therapy and periodontal regeneration.
In conclusion, laser therapy has shown positive results for the treatment of periodontitis and restoring periodontal attachment. Based on current studies, laser therapy has proven to be safe and effective in the treatment of moderate to severe periodontal disease, yielding desirable results compared to traditional periodontal therapy alone.